Thank you, Molly. Thank you again, Jim. Sorry Tony had to leave. We have time for just a few questions. I have one to get us started. I'm curious from both of you. You put forward some very compelling um, thoughts relevant to the SDGs. How do you deal with those nations in which the people we go to first, or should go to first, to initiate action to achieve the goals, are the ones who, through corruption and other things, are inhibiting progress?
Actually, though, my experience in working on violence against children in Africa and other nations is the exact opposite, in that nations, and I think Tony mentioned this, that a lot of developing countries really stood up for the inclusion of violence in the SDGs. But I've found just embracing of the willingness and need to address violence within these countries. So I can't speak much to how to do it, because my experience has all been that people around the world recognize the importance of this and in general want very badly to work towards preventing violence.
Yeah, I mean, I would echo that and say it was definitely a challenge, and there's certainly countries that have reservations. But often those reservations, it's a bit deeper than we think. It's not, we don't want to tackle this at all, or, they'll acknowledge this is important, and this is actually an excellent tool to say you've signed up to do this. They're wary of how it's done, and that's fair, right? So we know that approaches to for instance, tackling corruption or to, integrating communities are often sort of, it varies by context. And so I think often they'd respect that you sort of listen and make a sort of best fit, that we're not going to say, okay, we have absolutely, zero tolerance for this, or we're going to do it this way, but more of a conversation about, okay, this is our goal that we're getting towards. What are the first sort of trust building measures that we can do? Who else can we involve? So I mentioned regional initiatives. So often it's really helpful to work with the regional political or economic commissions, so that there's this kind of like peer effect. So on our panel, when I was chief of staff for the high level panel, we had several Latin American representatives for whom this is deeply political, right, and resonates in sort of deep ways. And they were much more amenable to a couple of things. They said, it wasn't, no, we absolutely can't have this on the agenda. First they were very hesitant. And as we got more into it, it was, one, we want to talk about some of the root causes. So things like arms trafficking, the drug trade, right? So, and I think you have some speakers later today that will talk about that. But, they want this to not be we are doing everything right and you are doing everything wrong and here's our prescription. They want to talk about, these are transnational problems often. Some of them are less so, but I think they want that acknowledgement and that talk about deeper causes in an honest way. Two was it definitely we got much more traction when we started talking in regional discussions, when it was peer to peer. So I think a lot of it is just in how you do it and how you discuss with them and understanding what their reservations are. And because often, governments are not monolithic. There's always reformers within governments. There's believers. And empowering them and also empowering reformers on the ground, civil society, is incredibly important to accountability. And that is very hard to do, but that is part of what this agenda is aiming to do. So, people on the ground who are in the communities are an incredibly effective tool in making sure that they're in the conversation and really putting that pressure on, because they've signed up to do that. That's supposedly part of this agenda. So I definitely think it's possible.
I don't see, everybody's pointing, but I don't see who's. Stand your name tag up if you would, please. There you go. Thank you. Elizabeth.
This is working. sure. No glasses of water.
Yeah, thanks for the presentations. But there are one or two issues that I think of that are really critical that we have to address is how do we increase the number of people on common messages, and the political agenda is very important, but even within the health arena, I mean, are we really integrating and sharing our messages in an effective way? And do our public health schools, do our medical schools, our schools of physiotherapy, I mean, just some of the practical things. We've been doing this for so long, but I'm not feeling the uptake of the messaging, and what is it that we can do, and how do we, through these partnerships, increase our impact and really help the most vulnerable?
I mean, I completely share that, it hasn't quite gotten that uptake, and part of it is, as I said, I mean, as somebody, so when I was chief of staff, we had a lot of people, experts and researchers come to talk to us to say, you're talking about the future of development, this is incredibly important. And one thing I noticed, and this is, I was coming from, my specialty before was development in post-conflict settings, so I'm sympathetic, and I was sympathetic at the time, but I felt like I was getting pulled in different directions often, that it was, there wasn't a cohesive narrative on violence prevention across those communities. And so, I mean, I think that's why it's interesting to think about partnerships like the Partnership to End Violence Against Children, to say, there's different levels, right? You need some kind of political messaging, really. And then you get into some of the, the more nuanced, right? The sort of, okay, here's where the evidence stands, and the things you can discuss as practitioners. But I think thinking of it as sort of levels of messaging, of here's our sort of tagline almost, that this is what we are identified with, and how we get your average kind of policymaker to care who doesn't know anything about any of the sort of substance beneath. And I think that needs to be almost part of instruction, right? Connecting policymakers and professional advocates to some of the academic communities to say, here's what we see, that there's this evidence, and it's so complex, and it makes it seem so hopeless, that we need to really come around. All right, how can we simplify? So I don't know if that's you mentioned specifically schools. It just strikes me that I don't know if that's part of the curriculum of, I know certainly in my graduate curriculum, it was very much sort of, here's all the research, read a lot of the literature, get to know all of this, nuance and complexities. And there was never a moment where it was saying, yes, this is all really important. But another part of that is, how are you going to explain that in a one-page memo to the National Security Council or to the Domestic Policy Council? So that connect, I think, is incredibly important. And, curriculums, and then I would hope that partnerships do a great job of this, because part of what a partnership can do is convene a lot of those different communities, and from that understand what each of those theories and each of those messages are, and come together around something that that everyone can unite behind, and then hopefully isn't lowest common denominator, as I said, because that's another risk. So I do really think the partnerships are an exciting way forward, and if you think about sort of the traditional, in the MDGs, the traditional health community, so they have 15 years now of experience, and they've really kind of got this down, right? There's, you have partnerships like Gavi and Global Fund, you have very clear messaging, you have advocacy communities that are incredibly involved. I don't see anything like that on the violence prevention side. Now, obviously, that's a little unfair because this is a new area, and so obviously you don't have that yet, because you don't have that 15 years. But I think thinking about how to draw lessons from that and broaden it to violence prevention would be incredibly important.
Thank you, Mally. We're going to hold off on questions because we are within 60 seconds of our schedule. What I'd ask you to do is get hold of Jim and Molly during the break, to have some one-on-one dialogue and keep this going during the breaks and during lunch. And I want to thank Jim and I want to thank Molly Tony too for kicking us off in just an incredible direction. And I'll turn it over to Louise for some.
Hi, everyone. Thank you so much for being here, first of all. My name is Louise, and I'm the director of the Forum on Global Violence Prevention. I typically don't speak at these, but I wanted to make sure that you guys knew what the breakout rooms were and what was coming up. So for the breakout sessions, we're going to have 3 of them. We're going to have community-based violence, violence against children, and violence against women. Community-based violence is the one that had the most names in the box outside, so we'll keep that session in this room so that our webcast viewers have something to watch during this session as well and can kind of participate remotely. The violence against children session will be in KEC 106, which is on this main floor, just back down the hallway. You'll see it. We'll have a sign up. And then violence against women will be up in KEC, oh, that's the wrong slide. It's in KEC C400. It's on the 4th floor. We will have a sign there as well and a staff person directing you. If you just go up the elevators to the 4th floor, it's just outside of the elevator bay. It's a big room with a big window. We call it our fishbowl room. We'll have a staff person, like I said, directing you. So the breakout guidance, we are going to ask you guys, using the perspective of whichever group it is that you select, to identify 3 main areas: collective violence, mental health, and resiliency. So thinking about these buckets, and your group can kind of discuss which ones they'd really like to focus on. Thinking about from your perspective, where did those intersections occur within the goals and your perspective? And then in that session, we'd like you to come up with 3 to 5 key findings that you will write on these note cards that will be in the room, and those will be the tools that you use for the report back session later. The second part of it will be questions for consideration for the second part will include: how can your group best interconnect with or impact other forms or fields of violence prevention or just sustainable development generally? So where are the interconnections between fields that your field, subfield of violence particularly can contribute? And then also, how can your stakeholders within this subfield of violence that you've selected work to advance the violence prevention agenda within the sustainable development goals? So we would like you to tackle both of those in the second topic, and whichever ones your group would like in the first topic. The schedule that we've put out as an outline is to basically split the time in 2. We've got 40 minutes and 40 minutes for part 1 and part 2, but if your group is having a really great discussion on part 1, by all means continue it and make sure that you have just a couple of findings on the other one. Do come back here at 12 o'clock because we will have a lunch set up here just outside of the hallway. There will be lunch boxes that everyone will pick up and come back. And we've got a lunchtime session that is in the agenda that you guys can look at. And then just following lunch, we will do the report back session and discussion. If you have not already done so, I highly recommend that you pick up a sheet outside that has all of the goals and targets on it, because it will be useful during the breakout session. And then for public participants, we also have the guidance this guidance on sheets outside as well, so you'll have that to be able to look back to. So for now, we will go to a break, and in between 10:40 and 10:45, please show up to your breakout room. Thank you.